Universal healthcare workers protested in Nairobi today, demanding permanent employment, payment of outstanding gratuities and salary equalization. The UHC workers camped outside the Ministry of Health headquarters, calling for payment of their gratuities before their payroll is transferred to county governments on the 1st of July 2025. Our reporter Dolly Mwirigi Mbuvi begins our bulletin with the following report.
This is for Migori County.
Hundreds of UHC workers drawn from different counties have held peaceful protests today, pushing for a swift implementation of their demands, among them discrimination by the Ministry of Health and permanent jobs. In April, an agreement was made between the Ministry of Health and the Council of Governors COG to transfer payroll management for UHC staff to county government starting July 1st, 2025. This transition will ensure that there is a budget in place to maintain current stipend levels. The ministry announced that workers will receive their service gratuity payment after the absorption process is completed.
Here because we have rejected what our CS Dolly said, and the communique by the Ministry of Health and Council of Governors that stated we should go back to work as of last week, and that our payroll is going to the county levels with the same stipend. We are here to say that we reject that proposal. We demand that we be put on permanent and pensionable terms. We demand that we be given our service gratuity, because today, as you can see, we have carried our flags because we have lost 44 universal health coverage workers.
The workers claim they have faced years of broken promises since they were hired in May 2020, especially regarding their transition to a permanent and pensionable PNP status. Additionally, these workers from different counties are demanding an end to harassment and intimidation from county chief officers. Last week, Health Cabinet Secretary Dolly led a meeting with the Council of Governors and health sector unions, including the Kenya National Union of Nurses, represented by Secretary General Seth Panyako. The main focus of the meeting was to discuss the transition of UHC staff to permanent jobs with pension benefit and to address the payment service for those who have been working on contract.
Na pia tungependa kuelezea kwamba wakaweze kutupatia gratuity yetu ambayo tumeweza kuhudumia kwa muda wa miaka 5. Siku ya leo tuko na ghadhabu kubwa zaidi, na tutakomea hapa. Tutazidi kukuja maeneo haya ya Wizara ya Afya kuendelea kuambia kwamba sisi tutaendelea kugoma na hatutarudi kazini.
If UHC is still alive, how can we say UHC is alive when you are paying us a half salary for 5 years, Mr. President? Bwana President, Bwana Kithure Kindiki, sisi wana UHC tunaumia.
We are not here to celebrate. We are mourning. In fact, this morning we've just lost one of our comrades. For how long will we be losing comrades, searching for their rights, which is their right, and they are really fighting to ensure that healthcare in our country is well done.
This meeting was a follow-up to previous discussion held with important stakeholders and specifically aimed to tackle concerns raised by UHC staff on April 1st, 2025. Dolly Mwirigi Mbuvi for Hope TV.
Daniel Nas